Paul Gowens, you're a senior healthcare quality manager and also paramedics in Edinburgh, Scotland. How have you improved survival in Edinburgh?
The key thing has been about having a multidisciplinary approach. So we have some nurses, some paramedics and some doctors working together with the resuscitation group and looking at the management of cardiac arrest. So we haven't learned how to do CPR any differently or use any different drugs. It's about ensuring the scene is managed well and we keep our hands on the chest and improve that flow rate.
And how have you implemented new resuscitation guidelines in Edinburgh?
The key thing for us with the new resuscitation guidelines is they aren't that different from the old resuscitation guidelines. So we were also already trying to do high quality CPR, take patients to the right place for PCI. So it's been important for us just to maintain the momentum. Defibrillation hasn't changed, drugs haven't changed. It's about maintaining that good quality CPR and taking the patient to where they need to be.
Could you tell me about Save a Life campaign in Scotland?
So one of the things about Scotland is it is a very remote and rural country. We have a very diverse population spread out. We know with the best will in the world, a paramedic in an urban environment might take 4 to 5 minutes to get there. But in a more remote location, might take over 10 minutes. And time on the chest is vitally important. So we've enlisted an army of volunteers. We're going to train 500,000 people to do CPR and get them to pledge to do CPR before the ambulance crew arrive to ensure that high quality CPR is carried out before we get there.
In Scotland, paramedics had cameras on filming heart attack patients. Why did you do that?
We found it was really important to get all the aspects of information from the scene. If you take a video with the paramedic wearing a camera, you can see everything. So things you would have missed on a paper reporting form or things the information you don't get from the defibrillator printout, you get to see everything and you can record everything. It was really important for feeding back to the crews.
Could you mention some guiding principles how to lead and develop emergency management?
The key things about leadership is it's not about what you say, it's not even about what you do, it's about how you make people feel. You have to work across a network of people, not just with the managers, but with the staff and leaders, and make them feel they're doing a good job. If people feel good about themselves, then they'll give their best. So it's really important that you make them feel well.
Thank you very much.